Hi guys. Yay. Here we are. Welcome everybody. We have Alex with us tonight, Dr. Alex Hill. Super exciting. I think she'll be here in just a moment. Yay. So we're here for another Prairie Circle Chat. Today, in honor of Lymphedema Awareness Month, we're talking about lymphedema and look forward to getting your questions. We have Paula answering questions for us as well. So if we don't get to it in the chat because it goes by so quickly, please make sure you put your questions in the chat so that we can answer them over time. Yay!
Oh, there we go.
I'm always trying to figure out the camera angles. You guys are so great at this. Why do I have so much space at the top? Yes, guys, I'm going to take some technical time because I feel like I should be able to figure this out.
It's a learning curve. I end up finding that little desktop tripod that I just bring everywhere with me.
Perfect. And then you just know, like, this is the set place.
This is it.
Oh, I love it. That makes sense.
It took a lot of trial and error, though.
Okay. That makes me feel a little bit better. So, hey guys, welcome to Prairie Circle Chat tonight in honor of Lymphedema Awareness Month. We're talking about lymphedema tonight with Alex, Dr. Alex Hill, and really excited to share some great information with you today. At PrairieWare, we're all about communities of support, and we really like to bring together our amazing field of experts that we work with every single day and just get a chance to share their incredible knowledge with everybody. And we find it's been amazing, the feedback. We get so many questions, even a few weeks after we do these, you know, where they're watching it on YouTube or on Instagram. And it's just been really awesome to have this positive impact on people and provide some pretty amazing information. So we'll just wait maybe one more minute, or let's just go for it because it's 4:32 Pacific Standard. Let's do it. Okay.
A little later if you're Eastern time.
Yeah. I mean, it's already 7:30. Let's go for it. All right. So let's start with introductions. My name is Holly Markwald. I'm the CEO here at PrairieWare. And Alex, take it away.
Sure. So I'm Alex. I'm a physical therapist. I specialize in pelvic health, oncology, and lymphedema. And I've been a physical therapist for 9 years this May. I feel like I just graduated, but at the same time, it feels like forever ago. And I'm currently in Jacksonville, Florida.
Awesome. Thank you for that. And I do want to say, in terms of the 9 years, one of the things that I really enjoy about everything that you do is how joyful and open that you are with education and support. And that's really a wonderful gift that you have that you share with people. I just wanted to say that at the top because I'm kind of a super fan. And your videos, I just feel like you destigmatize things and demystify and make it a regular everyday conversation. So I won't go too much more into fangirl because we do have a topic today. But,
well, I can fangirl about you too. So.
Yeah, but thank you. So let's start again in honor of Lymphedema Awareness Month. Let's start out with, what exactly is lymphedema, especially for those folks that may have heard of it but don't quite know? What would you share with them?
Sure. So lymphedema is essentially a abnormal accumulation of excessive lymphatic fluid. So it's not like if you sprain your ankle and you get some swelling and then that goes away. This is a different type of fluid that stays in the affected area, typically when the lymphatic system is damaged, or if somebody has primary lymphedema, if they're born with some genetic mutation that causes the lymphatic system to not develop properly. So that fluid just stays in that limb and requires specific treatment to treat it.
Right. And I think one of the things that, as I was learning about what is lymphedema and how does lymphedema affect people, what I was really surprised by, because I hadn't heard of lymphedema myself, was the millions of people worldwide that live with lymphedema every day.
Yes,
Yeah.
absolutely. And it's something that is often misdiagnosed or it's not treated properly. I've worked with a ton of people over the years who have been dealing with swelling, whether in their legs or in their arm, breasts, head and neck, their genitals, and they weren't given the appropriate treatment. And over the years, just kept getting worse and worse and worse. So I'm so glad that we're doing this tonight and that we have Lymphedema Awareness Month to raise awareness, not just for people who are affected by it, but for healthcare providers too.
Mm-hmm. And what are some of those common misperceptions around lymphedema that maybe you see in your practice?
I would say probably the number one thing, especially with my breast cancer survivors, is that they can't lift anything heavy or do very strenuous exercise because that's going to make it worse or that's specifically going to cause lymphedema, when we know that's just simply not the case. People who have lymphedema do need to do progressive exercise, ideally supervised initially to make sure that they have a good program. But I've worked with a lot of people who've gotten back to CrossFit competitions, or their job requires them to do a lot of heavy manual work, and they're able to get back to those activities just fine while managing their lymphedema. So I think that's really the biggest one, is just that they can't do anything.
And does that kind of tie into what you hear to be the most common question or concern with people with lymphedema?
I think that, and I think because it's just not talked about a lot, especially outside of cancer treatment or cancer rehab. Another big question that people have is, can this be cured? Because in today's day and age of medicine and healthcare, we expect there to be a cure for things, right? But unfortunately with lymphedema, this isn't something right now, anyway, that can be cured. Certainly there is specific treatment that can be performed. And there's been advancements in surgeries to help kind of fix or repair the lymphatic system after it's been damaged or after a surgery, and improve that lymphatic flow. But there's really no cure for it. And that's, I think, the number one thing that people coming in, when they learn that this is a lifelong condition, can we cure it? I think that's also a big one.
But what I'm hearing is, well, it's not curable, it is manageable in many different ways. And I think one of the things we try to do here at Prairie Wear is empower people to ask and really educate and empower themselves. And if it doesn't feel right, it probably isn't. So
Right.
Put it out there, ask the question. And one of many things that I love about your videos is you're just really practical about it. Like, hey, check this out. Does it feel the same? Does it feel different?
Right.
And if it feels different, talk to your medical provider,
Yep.
and really put it out there. And I think that self-empowerment for education is just so important.
Yeah, it's huge. And like you said, if something doesn't feel right, let them know. That's one of the goals that we have, especially in cancer rehab, with letting people know what the signs and symptoms are. How can you reduce your risk? And then following up with them after their treatment has ended so that we can catch that earlier. But if people are more empowered, they understand their condition, what the signs and symptoms are, they have a much better chance of managing it better and feeling more confident about managing it.
And how important is compression, in your opinion, to managing lymphedema? And compression can be truncal, it can be sleeves, it can be socks. We're just talking about compression anywhere on the body.
Absolutely. So compression is key. So with treating lymphedema, we have the complete decongestive therapy, or CDT. This is the gold standard for treating lymphedema, and one of those components is compression. That compression is going to help make sure that the swelling just doesn't increase throughout the day or at nighttime, and make sure that it gets back into the circulatory system. So that is very important, especially for people who have any type of swelling, stage 1, 2, 3 lymphedema. So it's Very important.
Yeah. And I think one of the things, if the great Google, if someone wants to check it out, one of the things that surprised me the most is how much of our body is a network for lymphatic fluid
Yes.
and our circulatory system. Like, it's incredible. And
Yes.
I didn't realize that either. I didn't have a vision of how much lymphatic fluid we have and how that flows through our body. And when restrictions happen and restriction points with compression, what that also does to, instead of let circulation happen, it restricts it and dams
Yeah.
it up. You know?
Yeah. Yeah. Exactly. And when you think about like the biggest organ of the body is the skin, and we have those lymphatic vessels that are just right underneath there. And so, like you said, if there's any type of constriction damage anywhere in the body, that can potentially impact the lymphatic system.
Mm-hmm. And I lost my thought. I'm
Happens
gonna have
all
to
the
find it,
time on
guys.
lives.
I was picturing in my head where in the circulatory system, just in the chest and underneath the chest, it's almost a watershed of circulatory area. And that's one of the places that we hear the most in terms of uncomfortable and, how can I, for us, because we make obviously a truncal lymphedema garment, we make our huggers. What we hear a lot of is just, it's so uncomfortable and this swelling, I can't get a bra on. But then if you don't have compression, it exacerbates the issue and the swelling.
Yeah, absolutely. And it can be very challenging to find compression garments for the breast, for the trunk, if they have a sarome or they need something that's not quite as high into the armpit, but too high for a compression bra to get to. If they have had a neck lymphedema, finding a compression garment that's comfortable to sleep in. If they have genital swelling, finding a compression garment that they can move in throughout the day, but also something that they can sleep in. So, that's one of the things that I love about Prairie Wear is the types of modifications that y'all have made with the bras to make it more comfortable for people to wear and easy to get off and on.
Yeah. And for us also just the easy care. So there's no special hang it out to dry and hand
Right.
wash and all of those things, which none of us like to do when we're feeling good. And when you're not feeling great, it's
Exactly.
even more work, So I think regardless of if our hugger is your garment or not, there's some really great products out there. And we really, really want to put some light out there to find something that works for your body and feels good. Work with
Yep.
your therapist. There's lots of great things out there. If it's a hugger, awesome. If it's something else, awesome. We're just here to say, try to find something
Exactly.
that
And
works
it's
really
a
well
lot.
for you.
Yeah. And there's a lot of trial and error too.
Mm-hmm.
Typically with a compression sleeve or a compression stocking, it's a little bit more straightforward. You either need just an off the shelf, like for example, small, medium, large, or you need a custom garment. But because everybody's anatomy is so different in the trunk and in the genital area, that can definitely make it more challenging. And sometimes it really just comes down to, like you said, working with a lymphedema therapist, working with a certified fitter, and just trying different things.
Mm-hmm. Awesome. And there's so many, I think, really great medical professionals out there, and there's more and more education about lymphedema. Certainly when we really started working with certified lymphedema therapists many years ago, there wasn't as much education or information even online at the time. And now I think there's lots of different people providing education, but also even on your social, if you guys haven't been to Pelvic PT, check it out because there's just so much great information. And I'm going to veer off. One of the things that we were going to talk about, and we still can because we have some time, is what exactly is lymphatic drainage and how does that help? And that's part of the management continuum. And
Mm-hmm.
it's something we get a lot of questions on. We're not medical professionals at Prairie Wear, so we always refer them back to medical professionals, but it is a question that we get a lot. And what is lymphatic drainage?
Yeah, so it's a very gentle hands-on technique. It's I don't like saying that it's necessarily a massage because a lot of people think of massage like a deep tissue massage, but it's actually a fairly gentle hands-on treatment that we utilize to help facilitate movement of that lymphatic fluid in that affected area. So for example, the arm, and moving it back into that circulatory system so that it can get reabsorbed. A lot of times with the manual lymphatic drainage, we can instruct the person how to perform it for themselves. Or a lot of times I'll have people who come in with their spouse or partner or friend or roommate and teach them how to do it as well, because it can be very effective in reducing the swelling, decreasing pain, and that kind of achiness, heaviness associated with lymphedema as well. And then if somebody has fibrosis, there's also some deeper fibrotic techniques that we can utilize and then follow up with that lighter lymphatic drainage.
Okay. And the intent of lymphatic drainage is to relieve swelling, but also relieve discomfort and pain.
Yeah. Mm-hmm.
Okay.
Yeah. And so a lot of people think, oh, I'm elevating my leg, I'm doing the massage, or if they have like a lymphatic pump device, one of the machines to do the massage for them, they think that they can just use that. But a lot of people, if they have lymphedema, they need that combination of the lymphatic drainage and wearing compression, because it might feel good and look great immediately after you do the massage, but over time, without that compression, it's just going to re-swell. It's just going to refill. So that compression is important to use after that lymphatic drainage.
And one of the things that I see as a common thread, and I see it on your Insta as well, is how important exercise is to overall health.
Yes, absolutely. So one of the major risk factors for developing lymphedema and for exacerbation or worsening of lymphedema is elevated BMI. And so we do encourage people to maintain a good healthy weight for them. I never condone, crash dieting or, this diet culture or anything like that, but we do want you active and maintaining that healthy weight. But with exercise, that muscle pumping action also helps to move that fluid and help to reduce that swelling as well.
Mm-hmm. And I think compression also helps get people
Yes.
active.
Yes,
Where you feel
absolutely.
secure enough, you feel confident enough. And that's one thing we hear a lot of, especially as your body is a different size sometimes when you wake up and you're like, okay, I still have to do my day. How do I do it? And so one, again, common thread that I hear is just keeping active, whether that's walking, regardless of body shape or size, just maintaining activity can help increase overall just feeling better.
Yeah, absolutely. And it doesn't have to be a full-on workout routine. It can be as simple as just going for a walk at lunchtime, or if you enjoy swimming or bicycling or Zumba or, rebounding. It doesn't have to be a ton of exercise, but just moving those muscles is going to be really good.
Yeah. Awesome. Thank you for that.
Yeah.
And I want to take a little bit of a different trail, because one of the things that I really enjoy about the education that you put out there is just the pelvic exercises and pelvic education. And I know we weren't going to talk about that necessarily.
I'm an open book. Let's go for it.
But I feel like it's something that we can all benefit from, whether it's lymphedema or you have a pelvic floor issue or you're in menopause. I can tell you that just being in menopause with your body changing so much, this helps. Having a strong pelvic floor helps.
Yes.
And I feel like this ties into also exercise. It's like, this is just, to me, one more exercise that you need to do for your body and to keep that strong core and pelvic floor.
Yep. Yep, absolutely. So, the pelvic floor muscles, they sit at the bottom of the pelvis. They do help with circulation within the pelvic area. So certainly if somebody has lymphedema in the pelvic area, then I certainly will recommend doing pelvic floor exercises. But like you said, they're part of the core. If you think about the core as your abdominals, your back muscles, the diaphragm, and the pelvic floor, and you think about it like a house, you can't have a solid house if you have a shaky foundation.
Mm-hmm.
And so working on your pelvic floor, being aware of it is really important. And even just doing general exercises can be very, very helpful to activate that pelvic floor and get a good, strong, functional pelvic floor.
Mm-hmm. And it helps with that proactive. So not only keeping strong core and strong pelvic floor, but things like urinary incontinence and prolapse. And I'm just pulling a few that were in my brain and
Yeah.
looking at your website. But I feel like those are things that as we grow older, anyone can experience. So
Mm-hmm.
that proactive exercise, once again, I think that's something that you can offer people right now.
Yeah.
For
Yeah,
yeah.
absolutely. And it's interesting with my two specialties, I'll have a lot of people that will say like, what do these have to do with each other? Like, how did you get into these specialties?
Mm-hmm.
But it's really, it's cool to be able to work with somebody on lymphedema if they have breast cancer and talk with them and screen them for other problems that they might be having. If they've had hormone therapy for their breast cancer, that can then send them into menopause, and that comes with it all the sexual dysfunction, the bladder dysfunction. They say, well, if you want to work on that, I'm also a pelvic therapist. We can work on that after this. And so a lot of times we'll finish with lymphedema and then we'll start on pelvic floor therapy or vice versa. A couple weeks ago, I was working with somebody with pelvic floor dysfunction, and we discovered she has lymphedema and we can work on it. And she had been, like we talked about before, trying to get help, and her doctors were saying, well, just elevate your legs, just wear socks, and nothing was helping. And so being, again, like you said, able to educate and empower people that yes, you can do something about this is really incredible.
Mm-hmm. It really is. And I feel that your way of approaching it in a very matter of fact and open way also makes a topic that can be very uncomfortable or embarrassing or perceived as private acceptable.
Mm-hmm.
And also something that people can relate to. And I've really appreciated that about what you've done to be able to communicate to people at a level where it doesn't feel overwhelming.
Thank you. I appreciate that. And
Yeah.
that's from my own background as being a patient back before PT school and having some really bad hip pain for years, and, doctors not believing me and me not knowing what was going on with my body, why I was hurting, and trying to find answers. And, I that is what really motivates me for how I work with people and how I educate people. I don't want people to fall through the cracks like I feel like I did. I want them to feel empowered and feel comfortable finding this information and talking with their healthcare provider about it. So thank you for that, for that kind words.
Yeah. Well, you've earned them. You definitely have. And my goodness, our time is very close to up already, which
I
is
know.
always amazing how quickly this goes. And so, in kind of circling back around, what I really want to empower people to do is get educated. And there's so many great resources. What is a resource that you would offer your patients that if they have some questions, definitely touch base with your medical professional. They're going to know exactly what you need for your body.
Yeah.
If they're looking for some additional information, what would you recommend for them?
For lymphedema specifically, I'd probably point them to the National Lymphedema Network, the NLN, that has a lot of really great resources. It has best practices, position statements, but they can also find a lymphedema therapist near them, because there
Oh,
are
great.
certainly not enough of us in this
Right.
country to help as many people have it. So I think that's a really great resource to just start out at.
Awesome. Thank you. So I think they are just
Yep,
nln.com.
I believe so.
And if anyone needs help finding that, please reach out to us. We're happy to help you find information anytime that we can offer that. And thank you for that. And in terms of your videos, and I'm not exactly sure where people would find information on pelvic floor. I always use your Instagram because
Yeah.
that's the format that I look at the most, but I know you're on other formats. So what I love about this content is that it's really accessible. And I think also one of the things that you address is it's not just women, it's also men, or however you self-identify. It's important that you check not only your breasts, but your testicles,
Yep.
that you're checking up here and down there.
Yes.
And I think that, and I love that you do that. I love that you're very inclusive, and it's important for us all to be aware. And because men also have pelvic floor dysfunction.
Yep.
And so this is something we can all learn about and support your partner in, or
Yep.
your friends or your family. And I think, yeah, that's probably, now I'm just, again, fangirling once again. But it was really poignant to me because I sent it to a friend of mine who had a child and she's having so many challenges and she's in pain all the time. And I was like, let's start here. And it really empowered her to be comfortable enough to go to her medical provider because she had a sense of what was happening.
Right.
You know?
Oh, that's wonderful.
Yeah. Yeah, it really was wonderful. And she was stress level here and then stress level here.
Right, right. And it's like the theme of tonight is empowered knowledge, right? So I do have multiple platforms. Instagram is my primary one. I'll cross share to my Facebook account. I also started a YouTube channel in January, and I will be having more instructional videos on there as well in terms of manual lymphatic drainage and exercises if you have lymphedema, doing compression wrapping. So that will all be coming throughout the year. I post weekly on my YouTube channel.
Awesome. Great. Well, you guys heard it here, and we'll be watching at Prayer. So, well, we're always looking for great resources, and again, just education and empowerment. And lymphedema is something obviously dear to our hearts. We love to help people, and we're all about helping people feel better and get better. And you and our medical professionals are such a huge part of that. So thank you so much. And I saw lots of things scrolling at the bottom. I'm not Instagram savvy, so I think we missed the questions yet again. But I know that Paula is there taking them and answering. So guys, if you have any questions at all, reach out to us. We're happy to connect you also with Alex, and you can also check her out on Insta. And yeah, that's all we have for tonight. Unless, Alex, you would like to share anything else tonight?
I don't think so. I think, like we keep saying tonight, it's being empowered and being educated, but also talking with others and advocating for yourself. Don't just take, somebody brushing you off and as the first thing. You have to keep advocating for yourself and your health.
Yes. Yes. Great.
We know our bodies, right?
We do. We do. And have that confidence that you do know your body.
Yep.
Yeah. And the answer's out there.
Exactly.
Cool. Great. Thank you, everyone. Appreciate you tuning in with us tonight, and look forward to our next Prairie Circle Chat. And Alex, thank you so much for joining us tonight. Really appreciate it.
Absolutely. Thank you so much. And thanks everyone for joining.
Thanks, guys.